So good morning. It's great to be in Plovdiv, isn't it? I came here in 1991 or 2. It's changed quite a bit, but it's still a beautiful city. So when I was asked to do this, I was thinking, well, what shall I talk about? And why am I here? I mean, that's the first question to ask. Why am I here? I have no formal medical training. Practically all of you have a medical training, or at least you have a training in natural sciences, and I don't. I'm a social scientist, I'm an economist. So why am I here? So today I'm going to tell you a story of why I'm here, and also to help you to understand what it means to patients. For instance, in my case, when you need a wheelchair for some things you do, and then you climb the second highest mountain in Western Europe after you find some treatment, and what it would mean if we found treatment for osteoarthritis. I have one bad knee. I don't know if it's stage 0 or 1, but my main condition is spondyloarthritis. Yeah, I had low back pain, so I would have been on that statistic from the age of about 14. And my brother has spondyloarthritis. My grandfather had spondyloarthritis, but I was told that women don't get spondyloarthritis, so it never sort of came up. I went to lots of doctors, and it got worse and worse, and it was just a fire burning in my back. It's the only way to describe it. And I also had problems with my intestines, and I had part of my colon removed, and people told me to eat more healthily. And you probably know that spondyloarthritis oft goes with Crohn's and with colitis. So that was the diagnosis. And then finally, after I changed doctors again, and I found a doctor who asked me about my family, and I had backache, and I was thin, and I was miserable, and he said, let's test for HLA-B27. And he did, and I was positive, as most people with spondyloarthritis are. And yeah, sent me to a rheumatologist, and suddenly, after 31 years, at the age of 57 or 56, I had a diagnosis. Yeah, we started on painkillers and DMARDs, and it didn't help at all. And the rheumatologist suggested to me that I take a biological. And I looked at this medication, and I looked at the side effects, and I thought, nah, don't want to do that. I've managed my disease for 31 years, and I'm going to manage this again. But I was wrong. And things just got worse and worse, and I was down. I was below 50 kilos, and I was exhausted, and I lost another job because I couldn't perform. And I said, okay, let's do the biologicals. So I had my first treatment shortly before Christmas, a couple of days before. And then on New Year's Eve, I flew to London with my family to visit my family in the UK. And on Christmas Day, and I had to use a wheelchair at the airport because I couldn't walk very far too far in an airport. So we got to my house of my parents in London. My mother wanted to go to church on Christmas Day, and she has dementia, or had dementia, and didn't know about my condition. And I said, yeah, sure, let's go to church. And we walked together 200 meters to the church. And I cried all the way through the service because I'd walked 200 meters, and we walked back. The treatment was beginning to work. And over the next weeks and months, I'd go for a walk every day and a bit further and go on hikes. And by spring, I was standing on my skis. And I realized that somehow the more exercise I did, the better it got. And when I'd been younger and fitter, I'd loved going to the mountains. So I thought, well, where does this stop? Could I do something radical to test? How far can you go? And I thought, yeah, I'll do something radical. And I planned a tour with some colleagues, which was 17 4,000-meter peaks in 5 days in the Swiss Alps. And everybody said, you're completely nuts, but I thought, let's try, The worst thing that can happen is I don't manage it. And, I wanted to go to the mountains. And this is the nice bit. We're going to be working hard, but now you can sit back for 5 minutes and look at some slides of mountains. Because the mountains, you see the most extraordinary geological phenomena of different types of rock and different layers and colors. And then they're millions of years old and they're covered with snow that fell yesterday. I love that. And I love the views. Now, on this tour, the weather was bad in the Po plain and everybody was sitting in clouds, but the view, if you're above it, is just great, isn't it? And I love glaciers and the way that ice that's thousands of years old just makes layers and structures. It looks like rock as well. And further up, the snow gets blown by the elements into strange structures and forms that you have to overcome. And of course, mountaineering, the last bit is perhaps difficult, but much of mountaineering is just walking somewhere first. And it's very meditative, and I find calm and peace and maybe think about work, good ideas. And you're so small in the mountains. You realize how insignificant we are. Can you see some people on the ridge? And finally, you get to the summits. You spend maybe only 10 minutes there, but you celebrate and you see the rest of the team. And yeah, I'm the old lady at the back. So I want to tell you just about one day of this tour briefly. And you can see the map here of the tour. You can see this is the north part is Switzerland and the southern part is Italy. So just off the map on the left-hand side would be Zermatt. And the tour more or less follows the line of the border, which is the pink line. And the tour is a red line with the triangles of the peaks we climbed and the thin red lines going down and when we went down somewhere to sleep at night in a mountain hut. So I'll tell you about the last day. So the last day we got up very early in the middle of the night to get to the first peak to see the daybreak. It's called the Zumsteinspitze. And then you have to cross a very steep ridge. And I'm not usually frightened in the mountains, but this ridge and looking down at the clouds below you really was quite impressive. But it was fine, I did it. And then you get onto the rocks of the summit and just look at those beautiful layers, and there's some lichen and the colors and the way that the layers of rock have been turned by the tectonic forces, and it was just a piece of work, a piece of art in the mountains. And after a bit you get past that and get onto the final rocks, and you're very respectful of the way that the rocks are and the way that they're mounted on each other, and you're careful not to tread on an unstable rock and maybe that would fall on the people behind you, and you just climb carefully and slowly until I got to the summit. The Dufourspitze is 4,634 meters high. And I looked towards the south and the east and could see the route I'd come and could see that the weather was still horrible in the Po Ebene. And I looked to the north and the west and I saw huge glaciers, and in the middle of the picture, the well-known peak of the Matterhorn, well below where I was standing, and far on the left horizon, the Mont Blanc, the highest. And I was standing on the only point that wasn't higher than that. The Mont Blanc is the highest mountain in Western Europe, and I was on the second highest one, looking out. I'd done it. But what did it mean? What has this got to do with me being here? So this is the story. So on this summit, there's a plaque celebrating 150 years since the mountain was first climbed. And on that plaque, there's a quote from Seneca. What you think to be the peak is nothing but a step. And you can perhaps imagine when you get there after months of training and 5 days of climbing and everything, and it says, yeah, it's just nothing but a step. It's a bit kind of think, well, not really. But ultimately, it is. And I thought, as soon as I was even on that peak, I was already thinking, So what's the next step? Because once you've done that step, it's gone. It's in the past. You have to do something else or do nothing. So I got down from the mountain. That was the real next step. And I started thinking about what had happened to me and about arthritis. And I got more curious. I thought, well, why did it take 31 years to diagnose my condition? And how many more people are out there like that? And why is there no cure? And all those questions that we're asking as well about osteoarthritis. And I got researching, and I don't need to tell you how widespread these diseases are. You know that. I have an interesting statistic. We know how widespread it is in Switzerland. We don't know how many people have arthritis diseases because our statistical collection goes through the cantons, and some collect and some don't, and it's not compatible, and it's a mess. But we do know, very Swiss, we do know what it costs. This was a study at the University of Zurich, and you can see the direct medical costs are the dark parts of the graphic, and the indirect costs are the indirect costs like disability and not working and that kind of thing. And it's the highest. And very few people realize that. And it's 3% of GDP in Switzerland. It's awful lot of money. And then I looked for figures about how much research is done. And this is a figure from the Bone and Joint Initiative in the US. I did find some vague figures in Switzerland, and they're very, very similar to this. You see the got my glasses. I'm going to get my glasses so I can see the slides I'm talking. So you can see that arthritis is about a quarter of the population. The incidence in the population is the blue balcony, and you can see the costs of public funding of various research conditions. And of course, as we all know, cancer gets the most, and arthritis gets almost nothing. And this is similar in Switzerland. It's estimated by a professor in Zurich to be less than 1% of medical funding for a disease that affects a quarter of the population and for which we have no cures, through the whole spectrum of arthritis. I don't think we have any cures. So I got thinking again, and I was thinking, why? Why is it like this? And it'd be interesting to talk to you all afterwards. I think there's several reasons, but there's two main reasons. And one is that it doesn't kill you. I mean, I don't die immediately of spondyloarthritis. I might die a bit earlier, but I don't die of it directly. And there's very few arthritis diseases where you die, and you certainly don't die directly from osteoarthritis. And the other reason, I believe, is because it mainly affects women. And here are some statistics. Interestingly, I've got another statistic, 4-to-1 osteoarthritis. So maybe I have to correct my slide, or maybe, I don't know, because before we were saying 2-to-1. But it affects women. And I believe that gender medicine is a huge theme, and these diseases have been neglected because they affect women. And it's just, unless it's about reproductive organs, it's not so interesting. Anyway, there's been some really interesting books published recently, which I can recommend. The first one was Invisible Women, very readable. Doing Harm, Maya Dusenberry is specifically about medicine. So is Eleanor Cleghorn, Unwell Women. She's a journalist at The Economist. But they're all good. They're all good. It's very interesting. And at least in Switzerland, there's been more attention to this theme since these books were published, and journalists publish statistics and talk about diagnosis of heart attacks and the sort of things you may have heard in your country too. So, came to my summary of the things I mentioned before. Little research, no cures, huge costs, huge suffering, And the interesting thing in Switzerland as well is that there was no organization, or is no organization, that funds raise in the private sector for arthritis research. There is a heart foundation, there's a lung foundation, of course, there's lots of cancer foundations, but nobody was fundraising for arthritis research. So I thought, well, what can I do about this? And this is the next step. I decided to form an organization for arthritis research. And I'd worked for a couple of years at a little foundation from a professor at university who was basically funding his own interests for arthritis research. And I also came to the conclusion that he wasn't funding things and doing things that were important to me. He was looking for small molecules to patent a new biological, or he was looking for strange esoteric things that I didn't even really understand. But he wasn't addressing the questions that I thought were important. So my foundation is for patient-centered arthritis research. And our vision, interestingly, because we talk with patients and we discuss this, it wasn't for cures, because the name, I thought, well, we need cures. It's a life free from the burdens of rheumatic disease. This is what the patients decided was the best thing. And our mission is to raise awareness about the need for patient-focused research and to ensure a strong patient voice in research, and also to influence the research agenda in the interests of people with rheumatic diseases. I'll come back to what we're doing to address those three things in a minute. Just to tell you, it was important. Various things were very important for our values. Okay, patients must have a voice, benefits for all. We need to address the fact that that we need an equity in this, and we need to address everybody with a rheumatic disorder. We need to collaborate because we can't do it by ourselves, and we need to act with integrity. Our activities are patient-focused and patient-led. That is very important in Switzerland, where this idea of that patient-led patient organization doesn't really exist. The patient organizations are funded by the industry. We want to be transparent, of course. We want to share information. And also, it's important we are based on science, because a lot of people immediately think, yeah, patient-led, they want to sort of collect herbs in the fields and do voodoo things. Or they think if we're talking about diet, it's also voodoo. But I think diet's important, as we all know, but it needs to be science. Our strategic objectives. We want to increase, to realize that mission, to increase engagement in patient-focused research. I was looking at a paper written by someone called Christiane Grill, who I think is in Austria, who I think there have been two papers in Switzerland with patients' involvement in defining a research agenda. We want to empower research advocates, and we define those both as patients and people in the clinic or people in research who are advocates for patient-focused research. And of course, we want to become the reference organization in Switzerland. We're in Switzerland at the moment. We're not looking further. So we started a few projects. The engagement in patient-centered research. There is a project at the University Hospital in Bern, prevention of pain chronification. Of course, it's a very important subject for osteoarthritis. The next thing on the left is a bit small, maybe. The Swiss Clinical Trials Organization is the umbrella organization for clinical trials that coordinates with all the university hospitals. And I'm in the working group there, defining guidelines and support for patient and public engagement. And finally, this is a Horizon project at the University of Basel. It's looking to maximize the impact of disease-modifying arthritic drugs, so DMARDs, in rheumatoid arthritis by the use of biomarkers. And there is a work package that involves patients supporting and helping to develop and pilot a facilitated integrated care model. strong research advocates for a strong patient voice. So we're doing a workshop with Martin de Wit later, and you are research advocates. So, of course, the cost touches various points. And there's also been a first training, a U-Party training in Switzerland for patients, and I'm at the University of Basel, and I'm teaching on three of the modules. And we want to become the reference organization. That needs communication. In August, we set on our first employee, a day and a half a week. We can't afford more. There is also a training at the Swiss Federal Institute of Technology in Zurich, where I'm teaching modern concepts in clinical research, teaching about patient engagement. And I've managed to speak twice to the Swiss National Science Foundation, and they have a very small program of grants that they give if there's patient involvement. So this is our website in the moment. We're redoing it already, but it's been a hard time. We started in the middle of the COVID crisis. That made fundraising a lot more difficult. It's hard to get funding. There are a few sources in Switzerland that give grants for patient-centered projects or patient involvement projects. And I thought our project was brilliant that we submitted, but they didn't. And there's a strong preference to take something that is patient involved, but very clearly top down. It's like run by a university hospital and some patients can talk. And I'm not quite sure how to address that. It's kind of tough. And otherwise, there is much, much more work than we could ever manage. But funding is a problem. Yeah, that is my little talk. And your questions. So I didn't go into some of the things that you mentioned. So I think people should just ask, because if I don't know the answer, I will say.
Thank you very much. I really enjoyed that. And it's really good to see that your small step on one mountain can add to a number of bigger steps to lead towards the creation and running of a really important organization. And we're delighted that you could be a partner with us. In one of your slides, you had 3 of the major diseases that are representing a burden for us as human beings. They are cardiovascular disease, hypertension, and the obesity and osteoarthritis. And very often we've looked at osteoarthritis as this sort of separate thing, but actually it is highly linked to hypertension and to diabetes and to obesity. And those diseases influence the outcomes of osteoarthritis. And if you happen to have those things and osteoarthritis of the knee and the hip and your mobility is reduced, that reduced mobility contributes further to the morbidity and the long-term mortality of those other comorbid diseases. And I'm so pleased that in this network we'll have such activity, strong activity on the comorbidities of osteoarthritis, which we need to raise awareness of. And I think you will serve as a really important partner for us to spread the word out.
Thank you. There's a question there at the back.
Thank you very much for this excellent, well, I even cannot call it talk. It's more like a confession. It's like a invitation for all of us to be more dedicated to what we are doing. But what I think you really succeeded with this talk is to put a face on everything we are working here about. And this is a really interesting concept. I'm a medic and I'm faced every single day with this problem. You have 10, 20, 25, 30 life story of your patients in your face. They are coming and telling you all these stories of pain and suffering. And one of the main reasons we are here is not because we want to cure osteoarthritis. We don't want to cure anything. We really want to make these patients to improve in their own way.
Yeah.
So thank you very much.
Thank you. Here, the gentleman at the back also. Sorry.
May I ask? Thank you, Judith, for the nice sharing of your story. That's really nice. I'm a scientist, and I'm wondering what you think is the gap that is now between a patient with a scientific community. Where do you see a point that we can really meet? Where do you see this communication? Where is the gap on your perspective with a scientific community and the patients? So what do you expect from our side?
There was an interesting conference earlier this year of Science Europe. This is probably many of you know it, the national science funding organizations of Europe coming together, and I was able to speak there. And the focus on it was, we were thinking a lot about the COVID pandemic, because there was quite a breakdown in communication in that triangle between politics, science, and the society, which expressed itself in different ways in each country, but it expressed itself more or less in every country. And I do think that one of the keys is public and patient involvement. And of course, a growing understanding that would grow out of that involvement, but also training on both sides, and awareness training, and basically, I think the things that we're doing or this talk, just to remind people, even in basic science, hey, this is about people, and this is a really valuable, important work that you're doing, and it's about making people's lives better. But I think it's always about meeting. On the patient side, the patients need to learn to overcome the hierarchy, because you're in a very vulnerable position. And even though I've got a lot of practice, I still find myself sort of nodding and saying yes if a clinician says something to me, and forgetting that maybe I haven't understood, but I'm too intimidated by the whole situation to answer, and an awareness of clinicians that happens. And you can overcome that. For instance, I also sort of as a sideline got breast cancer, and I was advised by a friend to take a friend when you go to the doctor, because you won't understand a thing. You're just too frightened. And clinicians should encourage people to take a friend. And on the scientific side and the clinical side, also training to meet the patients halfway. I think it would enrich the life of researchers and clinicians as well. And for that, you need some kind of awareness training and guidelines and support also in training at university level, ultimately. That would... Okay.
Thank you. I'm Professor Enroutin from Belgium, and I'm the president of the Osteoarthritis Foundation, founded in 2015. And thank you very much for your testimony, and congratulations for your initiative. Just to inform you that we have created with other associations dedicated to osteoarthritis in Europe an umbrella, which is coordinated by the OAFI. And these associations of different foundations and patient associations in Europe aims to push forward the World Osteoarthritis Day. And the aim is to have a special day only for the OA patients, because we regret that sometimes osteoarthritis is confounded with other arthritis, and we would like to really isolate it, this disease from the other one. And of course, you are welcome in this association, in this consortium that is also included in the cost actions, of course.
Thank you very much. Yeah.
Thank you very much for this excellent talk. Actually, I'm an orthopedic surgeon, and I see OA patients. The information and science we gather together is usually peer-reviewed. That means our peers just review the publications, and we read that and trust and rely on that. But when it comes to patients, I really don't have an experience. So I just wanted to have your opinion. Like, they are usually influenced by the media. An example, like my patients, 80% of them have heard about stem cell therapy, which is scientifically still under discussion. So what's your comment on that? Thank you.
Probably to get together with patients' associations and try to channel serious information through those associations. I mean, most endeavor to do that. And I mean, if you look in Dr. Google, well, sometimes it helps and sometimes it really doesn't. No? And this is quite a dangerous situation. That's why I emphasize that in our values that we need to appear to be very serious and no voodoo and no sort of Dr. Google solutions. But I think probably that, I mean, patient organizations should be responsible for that information, and you as a clinician can maybe steer them to that, because you don't have the resources to do it yourself. And if they hear it from a patient organization, it's probably better.
Judith, you mentioned physical activity and how you actually can use it in a series of aims to push yourself further and further. Mm-hmm. That's one important side of it. The other side, which we don't often talk about and research enough, is food and nutrition. Now, there's a whole world of supplements and supplementation, and there's lots of literature on that. But there is a new commission published by the Lancet. It's called the Lancet Eat Commission on Food, Planet and Health. It's sort of all related to sustainability. But they're trying to make the point that if we move towards better foods, more balanced foods and diets and more sustainability, that will impact on some of these major diseases that you outlined. And I think it's up to us to make a link to them, to this Lancet Commission. There's also a Lancet Commission being developed on osteoarthritis. And did you know the Lancet Commission on osteoarthritis leaders didn't even know that there was a Lancet Commission on food? So even the Lancet editors hadn't communicated with each other. It's as though food and nutrition are sort of on one planet and osteoarthritis is on another one. And somebody needs to do this interplanetary travel. Absolutely. I think it needs to be us and the patient organizations.
Maybe I can just briefly say something about that. I mean, I think the biologicals sort of anecdotally, intuitively help for about 75% of how I feel now compared to how I used to be. And the other parts are elements like moving every day. I never sit at my desk. I only stand, but I need to have the body tension and strength to do that. Enough sleep, stress management, meditation, that kind of thing, and eating. And eating has a huge influence, partly because I have this kind of underlying colitis thing, but it's not just what you eat, it's when you eat. And the Falk Institute in the US has done some very interesting research on that. So intermediate fasting has a huge influence on my well-being. So, like, you know, the 16-8 or whatever model, or 16-8.
Yes, sorry, thank you. I just wanted to suggest that we need to focus. I'm Elsa Matias from Portugal. I'm the president of Portuguese League Against Rheumatic Diseases and a patient myself. I just wanted to add to this discussion, and thank you, Judith, for your presentation. I think it's very important. We should focus on raising awareness on the general population, be able to get earlier diagnosis on OA, because one of the major things is for the person to get to the doctor and the doctor to the GP to get them further on, then to address the disease properly. And then we need, as already been said, to work on patient education, and so that people who are diagnosed know how to live better and what they can do to manage their own condition. Just my comments. Thank you.
good discussion, and thank you, Judith, for sharing your story and about the foundation. Thank you very much.